Hi, my name is Becky Bex, and I bring to you the View Show on YMB TV Live. Today on our health talk, we're going to talk about breast cancer. Since we are in October, it's all about breast cancer awareness. Here with me today is Dr. Yombo. Let's go for a quick commercial break, and when we're back, we'll begin the discussion. This program is sponsored by YMB Detergents, YMB Multimedia, and P. Canton Soap, Boreholes and Construction Limited. Welcome back from the quick commercial break. You're welcome, Mr. Yombo.
Thank you.
It's very nice having you here. So, Mr. Yombo, we are in October month and we all know it's all about breast cancer awareness. So I would like to ask you to tell us some things more about breast cancer, or when we mention breast cancer, what's it all about?
I think breast cancer, we are in the month of October. We all know it's a pink month, which more or less we need to sensitize the community about breast cancer. You know, breast cancer is one of the leading cause of death among, or one of the leading CA among women in the world. Okay, and it's the commonest cancer in the world. Okay, and even if you check the percentage of the prevalence, it's more or less 1 in 8 women. That's at any point in time when you take 8 women, you have 1 person that is likely to have breast CA, which is very high.
Okay. So, do you mean both genders are prone to getting the breast cancer?
Yeah, it's very common in the women. That's why we are more interested in the female as well. But in men, when you take the prevalence, it's like 1 is to 10,000. Okay. So it is a bit high before a male will get this breast CA. It's not really common, but they are also predisposed to it.
Okay. So what are the causes of breast cancer? What can cause breast cancer?
I think breast cancer doesn't really have a known cause, but we have predisposing factors or risk factors that can predispose someone to this breast CA.
Okay.
And some of the factors are family history.
Okay.
If there's someone in your family that has ever had a breast CA, so there's a likelihood that this gene that control this abnormal proliferation of these cells you can also inherit those kind of genes. So if there's a history in the family, and also if you like taking alcohol, cigarette, you are also predisposed to it. And also if you have ever had any breast myoma or like breast fibroadenoma, if you have ever had a lump in your breast, you can also predispose to it.
Okay. All right. So how do I detect that I have a lump in my breast, or how regularly should someone check for the lump in their breast?
I think the best way to do is that monthly, any female in the reproductive age, at any point in time, every month you need to do self-breast examination.
Okay.
And also periodically you need to also go to the hospital for examination.
Okay. All right. So how long or how often should I go to the hospital to screen my breast to check if there is any cancer or there's any lump in it?
Okay. If you do the breast examination every month yourself, then it means that if your age is below 40 years, it means every 2 to 3 years you can go to the hospital for the examination. Okay. But if your age is you are more than 40 years, 45, 50, 60 years and above, every year you're supposed to go to the hospital for an examination.
Okay. So I'm home, probably I'm very busy at work, and it's very hard for me to go to the hospital, but I would like to self-examine myself while home. What are some of the things I can do to examine myself?
Even if you go to the hospital for the examination, every month, you can't go to the hospital every month for the breast examination. So every month it is good for you to examine yourself. And the procedure is very simple. You can do that just after your bath. You can do that when you are standing in front of your mirror. You can do that before you even dress up. You can do all those examinations. It doesn't really take time.
Okay.
It doesn't really take time. So every month you need to be doing those examinations. So if you're able to detect any abnormality in your breast, then quickly you rush to the facility, a nearby facility, to lodge a complaint for them to do the examination to help you. Because early detection of this breast CA can really help you save a breast. Because if you detect it early, there's treatment there for you. But if you come in late, there's treatment there though, but it's not really safe.
Okay. So is it curable? Can breast cancer be cured?
I think in the community we find ourselves, a lot of people think the breast CA is they mostly associated with the spirituality, but it's curable. It's not anything spiritual. If you're able to detect it early, you'll be cured and your breast will be safe. It's not all the time that you have breast CA. They need to, popularly people say the uncontrolled breast. They need to cut your breast and all those stuff. Not really. But if you come in late, where the stage in which you are in, they can't do it, we can't do anything to help you, then probably the breast needs to be cut out for you to be safe.
Okay. So also I want to find out if the breast cancer is transferable. Let's say a lactating mother giving breast, like feeding the baby, can she transfer it to her or something?
It's not really safe, but you can't transfer breast cancer to someone where, because I have breast cancer and I'm breastfeeding, or because you are my mom, I'm also going to give the breast cancer to you. But the thing that it's a risk factor. If your mom have breast cancer, there's a likelihood that you are also going to get breast cancer in the future.
Okay. Right. That was very, very educative. Thank you. Please, do you have any last comment for my audience or any last advice?
Okay. We're in the month of October and it's Breast Cancer Awareness Month. And we need to sensitize the community on breast CA. That is very common in our community. Okay. So the thing that we are able to do to help ourselves or present this breast CA is the self-examination, which is key. The self-examination is key. So probably every month, at least every month after your bath, you need to schedule that one for yourself. So every month after your bath, you stand in front of your mirror, your hands on your waist or on your hips. Then probably you look in the mirror, you look at your breast, whether there's any changes, any difference in your breast shape, the size of your breast. Probably if you're able to look out of all those things, then probably look whether there's any ulcer on your nipples or there's any discharge coming from your nipples. Okay, when you're able to see all those stuff, then probably you fold your breast to, you put your hand on your breast. That's most, we have about different ways to do it. Probably you can go the circular way, put your hands on your breast in a circular form to see whether there's any mass or lump in your breast. So if you're able to detect all those types, also you need to check in your armpit, that your axillary region, you need to check whether there's any mass in there. So if you're able to do all those types, probably it will help you. If you see any changes, whether there's any discharge, whether there's any blood coming from your nipples, probably it will help you present this case to the hospital as early as possible, so that if there's even a breast cancer, it will be able to detect early to help save your breast. Thank you. And also allow in this month, allow your husbands to also fold your breast to see whether there's any mass in it.
Okay.
Thank you.
All right. Thank you. All right. So since we're still in the month of October, advise that you see the doctor or you go to anywhere they are doing breast screening, because most of the people, they are just doing it for free. See you next time on The View Show. My name is Becky Bex once again. Bye.